How can we afford Medicare for all? It's a lot more efficient than for-profit insurance. Instead of hundreds of insurers negotiating with thousands of doctors and hospitals, driving up costs, the federal government leverages the power of 330 million Americans to rein in all medical costs, including prescription drug costs. Conservatives argue that Medicare for all is expensive because the government will need to spend more on care than it currently spends. That's true, but ordinary Americans will pay less for health care. With Medicare for all, you no longer pay premiums, deductibles, and copays, nor do you pay fees for insurance through lower wages. Your taxes pay for health care, with the wealthy paying more. Conservatives don't like to admit that by their own estimates, Medicare for all saves the U.S. $2 trillion on total health care spending over 10 years. Why are people so worked up about Medicare for all? In truth, a solid majority of the public support it. More than 7 in 10 Americans. It's the healthcare industry, especially the insurance and pharmaceutical companies, that oppose it because it costs them money. How do you know Medicare for all works? Because it improves and expands on traditional Medicare, and traditional Medicare works. Medicare for all guarantees everyone cradle-to-grave coverage, and it fills Medicare's coverage gaps and delivers more benefits like vision, hearing, and dental care. We also know that Medicare for all works because every other wealthy country has some form of government-administered health care. Their citizens see the doctor and use the hospital as much or more than we do, and they live longer. With private insurance, for-profit health companies are the winners and Americans are the losers. Medicare for all reverses that and makes winners out of the American people. It's time to stop rolling the dice with our health care.